Good afternoon. Thank you so much for being here. How many of you have actually heard of this 1115 waiver? That's amazing. Thank you. I tell people all the time, when you think about what we're trying to do here, this is all about trying to put the person who's using our service at the center of what we're trying to do. Individuals shouldn't come into state government thinking they have to navigate 12 agencies. We should basically take upon ourselves to understand that individuals who are coming into systems of care across state government, they're already dealing with a number of things. So having to then navigate 12 agencies, all that have their own respective rules, requirements, regulations, can be an enormous task. So this waiver, and what we're talking about today, seeks to try to navigate a healthcare system that is complex already, and layer in behavioral health. You're talking about one of the biggest challenges that people face at a real crisis in their lives. So that is what this is all about. If you go to the next slide, because I'll talk about all of these elements a little bit different. We talk about this 1115 waiver, but the 1115 waiver is only going to be one component of what we're trying to do in terms of trying to transform behavioral health care in the state of Illinois. I tell people there isn't a person in this room who either doesn't know someone personally, a family member, a neighbor, or someone down the street that's dealing with issues of behavioral health. And as Dr. Shaw said, there has been this stigma associated with talking about anything with respect to behavioral health, particularly in our communities. I can tell you, we don't talk about this generally where I'm from. You basically say to people that so-and-so is going to be going away, or we all know someone that nobody in the family wanted to talk about. Now's the time to really try to destigmatize one of the most critical healthcare issues that we're trying to deal with. And that is what we're trying to do with respect to this transformation. But the waiver is only going to be one component. In addition to the waiver, we will be submitting what we call state plan amendments. And state plan amendments will change what we will cover under the Medicaid program. And in addition to the state plan amendments, we will be submitting what are called advanced planning documents, which is just a fancy way of saying our technology needs to keep pace with what's going on in the health and human services transformation. On the next slide, what you will see is what an 1115 waiver is. You know, it's one of those things you talk about. What's an 1115 waiver? Well, we're asking the federal government to waive our ability to do some things that normally wouldn't be covered under the federal rules. It will give us the opportunity to try innovative approaches, add some additional services that traditionally wouldn't be paid for, be able to do different types of things in our program that make sense for Illinois. So a lot of states seek 1115 waivers, but we want an 1115 waiver that will help us to design the best behavioral health system in the state of Illinois. As all of you know, we spend far too much time trying to get from one budget cycle to the next. Think of how it would be if we had an opportunity to think about what behavioral health should look like in this state over a 5-year horizon. 5 years. That's what an 1115 waiver will give us an opportunity to do. And what we will have to prove to the federal government is that this will be budget neutral. In other words, we say to the federal government, you will spend no more on this system that we believe is fragmented and doesn't work well for the individuals who use these services. If we spent that money differently on a different array of services, net, you're going to be better off by allowing us to make investments in our systems for all of the money that we will save when we do this. So it's not free money. It's not like the state can then take this money and do something else with it. The beauty of the waiver is that we will say that we will spend 2% less than what we ordinarily spend in the Medicaid program over these 5 years, and we will then take what that amounts to is $1.2 billion and invest it in our behavioral health system in the state of Illinois. You add to that $1.5 billion through our state plan amendment and the services that we're going to be matching going forward. And this concept will allow us to invest over the next 5 years $2.7 billion in our healthcare infrastructure, specifically focused on behavioral health over the next 5 years. For us, it's a win for the state of Illinois. On the next slide, we started to tell you what the waiver will do. So the waiver in its current form is pretty simple. We ask for a set of waiver benefits, and then we have a set of waiver initiatives. The overall goal is that we are going to transform healthcare in this state, as Dr. Shaw said, focused on the integration of physical and behavioral health. And now I'll walk through what we include in the benefits, and then I'll talk about what the initiatives are. So we have 6 goals when we think about this transformation. The first goal is to rebalance, and we use that word in a very meaningful way because someone said it's all about closures. No, it's not. It's rebalancing our healthcare system so that we reduce the over-reliance on institutional care and build out the community-based infrastructure that we know we need in this state. There will always be the need to have institutional care, but today, far too many individuals remain in institutional care because we don't have the community-based infrastructure to support individuals in the right place, at the right time, in the right setting, for the right cost. So this is about rebalancing that system so that we reduce the over-reliance on institutional care and move towards community care. The second 2 goals go together. As we said, this is all about integration. So it's integrating our behavioral health and physical health for individuals who have high needs, and then integrating behavioral health and primary care for individuals who have lower needs. The next item is focused on the whole issue of making sure we have a comprehensive set of services. So a focus on the core behavioral health services that we need, but also a focus on preventive services. So you know, very seldom do we get an opportunity to make investments in prevention. We need to have a focus on our core delivery system as well as preventive healthcare services as well. Nothing happens in this environment without understanding the social determinants of health that are going on with respect to individuals. And the next goal is to allow us to support those issues that we know are critical. Medicaid already pays for transportation services, but we don't today include services around supportive housing and supportive employment. So those will be 2 additional elements of this transformation. And finally, there has to be a focus on outcomes and value-based payments. We need to try to understand what's working and make additional investments in what's working, and things that don't work, we have to be honest enough with ourselves to say, that's not working and we should stop doing it. So that's a big part of this transformation. On the next slide, we go into the specific benefits that will be included. I mentioned before, supportive housing services. Supportive housing services are critical. Now, the federal government, through Medicaid, will not pay for rent subsidies. However, Secretary Dingus and his team have been leading efforts in partnership with IDA and our other housing partners to make sure that they can focus on the rent subsidy piece. But a lot of times individuals need supports around being able to remain in stable housing, and that's what supportive services for housing are all about. The second piece are supportive employment services. And while the Illinois numbers are a little bit better than the national average in terms of individuals who are able and have employment with behavioral health conditions, we still have a lot of work that needs to be done. The third element, which is very important, is when we started this conversation, Secretary Dina said that we started to take a look at human services, not just in terms of our core human services, but also in terms of corrections. There are individuals who are in our correctional system who are parents to people who are in the rest of our systems. There are individuals in our correctional systems who we know, if we don't start to link them to services before they leave corrections, we will have recidivistic behavior, and they will be right back into the systems in the first place. So what we are asking the federal government to do is allow us, prior to release, to start making the linkages that need to be made so that individuals transition much more seamlessly. You link them to providers to help them get the medical care that they need. And we will, through this behavioral health transformation, focus on our Department of Corrections, which we all know is the largest behavioral health institution in the state, and be able to work supportively with corrections and the Cook County Jail and our Department of Juvenile Justice to start these services for justice-involved individuals and linking them to care before they leave our systems. That's a very critical component of this transformation. And then we have services that we need to do around our substance use disorder continuum. We don't have all the services that we need in that continuum, so we're going to be adding some additional services, withdrawal management services. We're going to be including case management, recovery coaches, those types of services in our substance use disorder continuum to build out this process. And then in addition to that, on the next page, we will be optimizing the services that we have today in our behavioral health continuum. We need crisis beds. We need the ability to step individuals down from institutional settings into more settings that are appropriate where they don't need institutional care. So those become critical as well. And then the last two services are services that Director Sheldon will talk about because they are integral components to what we believe are critical in the area of our children's services with respect to behavioral health. And these are intensive in-home services as well as respite services. So we want to have a full continuum of services to support the behavioral health needs that we believe are necessary for adults and children that are a part of this system. So why don't we move forward for our next slide. Not doing it? Okay, so that's all the benefits. That's the services that we're going to focus on. But what are the broad-based initiatives? As we talked about before, we have to have the integration of physical and behavioral health. This is all about what we call whole person care. You shouldn't have to think about individuals compartmentalized in terms of their physical health and behavioral health. If there is the opportunity to focus on the whole person, if you are with the primary care provider and that primary care provider has the appropriate training to be able to help you with your diabetes as well as with depression, why shouldn't that happen? Why should we be trying to send you to another provider? This is all about the integration of physical and behavioral health, and that's the key part of this initiative. The next set of initiatives, certainly that are near and dear to our child welfare partners, and certainly our First Lady who has just joined us from another meeting, thank you as well, are services that will focus on early childhood mental health consultation as well as home visiting services. Once again, as I said, not just focusing on the services that we need later, but starting as early as we possibly can in having an orientation around prevention. Workforce strengthening. We know we don't have enough psychiatrists in this state. But when we think about what's necessary to take place in terms of the integration of physical and behavioral health, it's a team-based approach. So we need not only psychiatrists, we need psychologists, we need licensed clinical social workers, we need nurse practitioners, we need the full range of clinicians who can support individuals. And being able in this state to have loan forgiveness programs, workforce development programs, being able to focus on building the workforce of the future that we need to support this continuum will be critical. So this is a very important aspect of what we're trying to do in terms of this transformation. And finally, services, once again, focused on what we call first episode psychosis, giving us the ability to address things earlier as opposed to waiting later on until things are certainly much more difficult to work with in terms of focusing on the healthcare and the transformation that we want to happen in behavioral health. So that's the initiatives that are part of this. So you have the benefits and you have the initiatives. On the next slide, what we talked about before is that we're going to do the waiver, but we have to do some other things. And in the state plan amendment, we're asking for a handful of services that are equally critical to what we're trying to do. The first are our integrated physical and behavioral health homes. That's a key component to what we're trying to do as a part of the transformation. And that will be taking place through a state plan amendment. So the integrated physical and behavioral health homes will look different across the state. What we need in Rantoul will not be what we need in Rockford. What we need in Champaign won't work in Cairo and Chicago. So we want to be able to have integrated health homes that represent what local communities need in order to support this transformation. So that is what we're looking for in the health homes piece. And then in addition to that, we're going to be requesting and have submitted already state plan amendments for crisis stabilization, mobile crisis response, medication-assisted treatment, and a uniform assessment. Christine, cans and ANSA. If we are going to ultimately move to having outcomes, shouldn't we all be looking at things the same way so we understand what's going on? So we are going to move in this state to try to have a uniform assessment for children and a uniform assessment for adults. That doesn't mean we're trying to screen every child in the state of Illinois, but kids who are coming into our care, we need to have a uniform way of determining what is the service package that they need in order to help them be successful in this healthcare delivery system. And then finally, as I mentioned before, the data is critical. And the APD gives us the ability to get 90-10 money from the federal government. And Director Sheldon will tell you, 90-10 money is pretty darn good. So to the extent we can get 90-10 money from the federal government to help us transform antiquated systems that have not been updated in many respects since the early 80s, we have to have the ability to make data-driven decisions around what's necessary and be able to do that across our state partners, but also our community stakeholders as well. So that's the final element of what we're looking at in terms of this broad-based transformation. Is it a heavy lift? Yes. Is it long overdue? Absolutely. But we have an opportunity here that we will not normally get again, and I think it's incumbent upon us. We're very focused on doing everything that we can to improve the lives of people that we are trying to serve, which is what public service is all about.